Hello, my name is Member Prissy Samantha and I'm from Gayaza High School. I've been working with a team of 4 girls in a project called the Rover, and my teammates have been Mwanguzi Masi, Mulunji Masi Tabitha, and Janice. Well, the World Health Organization declared the coronavirus outbreak a public health emergency of international concern on 30th January 2020 and a pandemic on 11th March 2020. Over 170 million people have been infected with the virus as of June 9, 2021, and in Uganda we've had over 40,000 cases and over 330 deaths. The World Health Organization came up with measures to control the spread of the virus. For example, the use of face masks, the use of alcohol-based sanitizers, and social distancing. But the methods that have been used to disinfect rooms and spaces have not been 100% effective, with infection rates still on the rise. Shared spaces like aeroplane cabins and classrooms have been categorized as high-risk areas, and in countries like Uganda, schools remain closed because it's very risky to let students study, and yet the methods that are used to disinfect rooms are not very trusted and are not 100% effective. This has disproportionately affected students who have the right to study, who have the right to education. The current measures used to disinfect spaces are tedious, they are time-consuming, and are not highly effective.
Traditional disinfection methods have been used for centuries, but the truth is even the most vigorous cleansing with hot water, bleach, and/or disinfectant can miss even the most harmful germs and bacteria. Most of the chemicals used for sanitizing are not environmentally friendly, such a one being sodium hypochlorite, which is extremely irritable to the skin. Alcohol sanitizers are not only also irritable, but also individualized. And the fact that the interior environment is not sterilized properly puts someone using alcohol sanitizer at risk of contacting the germs again. Such chemicals cannot be used on edible substances, and some disinfection methods leave a damp environment where fungi can thrive, thus sometimes causing fungal infections.
The use of UV light is proven to be effectively a disinfectant idea, because the UV lights have their benefits. They do not leave the place damp. Then that's why we come up with this idea of the rover, where this rover can be used in places that are preoccupied. For example, the airplane cabins, the hotel rooms, and then the classrooms, despite of them having the desks, the hospital beds, the people. So the rover has the capability of sensing the obstacles, and then it will be able to reach out to all those areas where people don't reach while they are cleaning. Then the rover also reduces the risk of us getting the COVID-19, because when people are to clean places where other people have been, yet they are not sure whether the places they're cleaning and the people who have left the place had the disease, so it reduces the risk of one getting COVID, because one will not have to expose themselves to the place where one has been. So rover is such a good idea.
Project that our innovation will lessen the pinch of the pandemic and enable students and civilians resume daily activities with ease. It will reduce the long-term costs of disinfecting spaces and mitigate the spread of the virus. We also believe that our innovation will create employment opportunities for operators, maintenance technicians, and assembly line workers needed to put together the project. We look to have a full-scale model of our prototype ready for market after it has completed the necessary tests and quality control. We foresee a future where students and humanity in general is able to share spaces without perpetual risk of contracting a deadly infection.